Good evening. Namaskar, everybody. So we are back again on the Facebook Live session. And इस बार हम लोग एक बहुत ही इम्पोर्टेंट टॉपिक के बारे में बात करने वाले हैं. मैं डॉक्टर स्वाति पंडित हूँ, कंसल्टेंट एंडोक्रिनोलॉजिस्ट एट मैक्स हॉस्पिटल साकेत. और अभी मेरे साथ डॉक्टर सुजीत झा भी आपसे बात करेंगे, जो कि प्रिंसिपल डायरेक्टर हैं डिपार्टमेंट ऑफ एंडोक्रिनोलॉजी, मेटाबॉलिज्म एंड डायबिटीज के. सो हम जिस टॉपिक के बारे में आज बात करने वाले हैं वो है कोविड-19 पैंडेमिक और डायबिटीज. कोविड-19 की ट्रीटमेंट में एक बहुत ही इंपॉर्टेंट ड्रग दी जाती है जिसका नाम है स्टीरॉइड्स. तो डायबिटीज पे क्या असर पड़ता है कोविड-19 का, और जो ड्रग्स यूज होती हैं जो ड्रग्स यूज होती हैं कोविड-19 के मैनेजमेंट के लिए, उनका क्या असर होता है डायबिटीज पर. तो इन सब चीजों के बारे में हम बात करेंगे आज. आप सभी जानते हैं कि कोविड-19 हर तरीके से हर उम्र के मरीजों को इफेक्ट करता है, और स्पेशली डायबिटीज के मरीज, क्योंकि वो एक क्रॉनिक इलनेस है और उसमें एक इम्यूनिटी या हमारी जो प्रतिकार शक्ति होती है वो कम हो जाती है. तो उस केस में कोविड-19 के कॉम्प्लिकेशंस ज्यादा होने के चांसेस होते हैं. पर अगर आपकी शुगर लेवल्स अच्छे से कंट्रोल्ड है और आपका ओवरऑल डायबिटीज कंट्रोल और ब्लड प्रेशर कंट्रोल और बाकी कोमोर्बिडिटीज का कंट्रोल अच्छा है, तो आप आराम से इस इलनेस में से रिकवर हो सकते हैं. बट द थिंग इज कि एक बहुत बड़ा चैलेंज आता है डॉक्टर्स के लिए भी, और जो टीम मैनेज कर रही है डायबिटीज को या कोविड-19 विद डायबिटीज को, उनके लिए भी ये शुगर लेवल्स बढ़ने लग जाती हैं इस इलनेस के दौरान. मोर सो जो कोविड से रिलेटेड या इस डिजीज से रिलेटेड जो स्ट्रेस प्रोसेस होता है उसकी वजह से शुगर्स बढ़ती हैं, और साथ में एक ड्रग दी जाती है जिसका नाम है स्टीरॉइड्स, उसकी वजह से भी शुगर्स बढ़ने लग जाती हैं. तो इन दोनों चीजों के बारे में आज डॉक्टर सुजीत झा हमसे बात करेंगे और आप लोग सबको इसके बारे में डिटेल में बताएंगे. ओवर टू यू सर.
So thanks, Swati. And sorry, a bit late. So Swati, who's the consultant endocrinologist, has been working. We're working together for the last 10 years time. So sorry, I have to get to run and rush somewhere. So as Swati was saying, that diabetes itself in COVID is a problem. We all know Max Healthcare data, Johan data, world data shows that patients with diabetes have got 3 times more trouble and more chances of having complications. Now, I've been talking this for last many months. In fact, the first Facebook was on this live a few months ago. Now, we know that. Now, earlier we said that if you control diabetes, or its का long-term impact होता है. So we never thought कि pandemic इतने दिन रहेगी और हम लोग कंट्रोल करेंगे तो फायदा होगा. मैं क्यों इस बात को हाईलाइट करना चाहता हूँ कि अगर आपकी डायबिटीज है और आप कंट्रोल करते हैं तो बेनिफिट लॉन्ग टर्म मीडियम टर्म पड़ता है. ये पैंडेमिक हमारे साथ रहने वाली है अनफॉर्चुनेटली. वैक्सीन आए, खुदा करे वैक्सीन आ जाए, सब कुछ सॉल्व हो जाए, सब कुछ खत्म हो जाए, मैं और आप ज्यादा खुश होंगे, हमारी भी जिंदगी अच्छी होगी, आपकी भी जिंदगी अच्छी होगी. लेकिन अगर मान के चले अगर पैंडेमिक 6 months 8 months जनरली प्रिवेल करता है वर्ल्ड में, तो हमारे पास इनफ टाइम है डायबिटीज कंट्रोल करने के लिए. इन केस आपको अगर पैंडेमिक से सफर भी कर जाए तो you should be able to solve the problem. That's one. So if you don't know, a lot of people also say that first time they have been reported on COVID-19 diabetes. तो आप अपना शुगर टेस्ट नहीं कराएंगे, जब आप कोविड से एडमिटेड होंगे आपकी जीपी फिजिशियन डॉक्टर्स आपको शुगर टेस्ट कराएंगे तो आपको मालूम चलेगा शुगर है, शायद पहले से था. बी, कोविड-19 न्यू डायबिटीज प्रेसिपिटेट कराती है. क्या ये नई बात है? कोई भी इंफेक्शन हो तो डायबिटीज प्रेसिपिटेट हो सकती है. तीसरी बात, अगर कोई भी इंफेक्शन के बाद अगर स्टेरॉइड्स दिया जाए तो शुगर और वर्सन होती है. तो इसलिए आपको इस बात को जानना जरूरी है कि आप जो है अपना शुगर जो है टेस्ट कराएं, और पहले कराएं. अगर शुगर बढ़ी है तो अपने डॉक्टर फिजिशियन से एंडोक्राइनोलॉजिस्ट से मिल करके शुगर कंट्रोल करें. अगर आप किसी कारण से कोविड से if you're affected by COVID, then you must get your diabetes control. If you're already on medication, continue medication in consultation with a doctor. If you also started steroids, then steroids are like Medrol type medications, Dexona type medications. They need to be controlled as well, and they need to be taken because of the swelling of the lungs. So what matters that once you're taking steroids, the sugar goes up. When the sugar goes up, you need more medication. So today, the main point of highlighting the diabetes and COVID, which remains a problem, you should be screened, you should be treated. Once you get COVID-19, you might get upset with the new diagnosis of diabetes. That also needs to be controlled by medication. If you happen to have COVID-19 and if your doctor, physician, respiratory physician has started steroids, your sugar may further go up. So it's very important that you treat your diabetes very well so that the diabetes related complications, the COVID related complications doesn't happen. Whole Delhi, large part of the country is quite heavy into the phase 3, what they call it, phase 3 rise of pandemic in Delhi particularly, and large number of people on steroids. So one thing I want to also tell you about steroids, that जो steroids होती हैं वो नॉन डायबिटिक को भी डायबिटीज में कन्वर्ट कर देती है, हम लोग बोलते हैं स्टेरॉइड इंड्यूस्ड डायबिटीज। लेकिन ये बात भी जाने कि 40 से एज ग्रुप में ज्यादा में अप टू 15% 20% डायबिटीज प्रेवलेंस रह सकती है। जनरल पॉपुलेशन प्रेवलेंस 10 to 13% है। जैसे जैसे एज बढ़ती है, मोटापा बढ़ता है, डायबिटीज की प्रेवलेंस बढ़ती है। तो ऐसा हो सकता है कि आपकी डायबिटीज थी या अंडरलाइन प्री डायबिटीज थी, वो स्टेरॉइड से प्रेसिपिटेट कर गई है और हमारे पास चॉइस नहीं है, बिकॉज स्टेरॉइड्स एक सबसे लाइफ सेविंग ड्रग्स है डायबिटीज कोविड-19 में। अगर आपको कोविड-19 है तो स्टेरॉइड्स देना ऑलमोस्ट, जिसको लंग में स्वेलिंग है या आपने सीटी स्कोरिंग कराई लंग की, लंग में ग्राउंड ग्लास अपीयरेंस है, स्टेरॉइड्स एक एसेंशियल पार्ट ऑफ द ट्रीटमेंट है। So it's very important to understand that अगर आपको स्टेरॉइड दी जा रही है और डायबिटीज भी है तो स्टेरॉइड्स आपके शुगर को रूफ पे पहुंचा देती है। तो जनरली 5 से 8 घंटे से 12 घंटे तक अगर आपको डेक्सामेथासोन या प्रेडनिसोलोन मॉर्निंग में पड़ी है तो आप देखिएगा पोस्ट लंच अप्रोक्सीमेटली दिस टाइम 5 o'clock the blood sugar tends to go up very high and it may settle down by next day morning. तो ये थोड़ा ट्रिकी सिचुएशन होता है हमारे लिए भी, डॉक्टरों के लिए भी डिफिकल्ट होता है, बिकॉज अगर शुगर बढ़ती है फिर घट जाती है, फिर होता क्या है। एक दूसरी बात है कि स्टेरॉइड्स की डोज हम लोग जनरली स्टेरॉइड्स जो है टेम्परेरी हम लोग देते हैं, तो ऐसा होता है कि इट्स फॉर अ शॉर्ट पीरियड ऑफ टाइम शुगर गोज अप फॉर 6-8 आवर्स। और दूसरी बात क्या होती है कि स्टेरॉइड्स नॉर्मली हम लोग ज्यादा डोज देते हैं और धीरे धीरे कम कर देते हैं। तो हमारी टेक्निकल डिफिकल्टी क्या है कि एक तो स्टेरॉइड्स टेम्परेरी ब्लड शुगर बढ़ाती है, दूसरी ज्यादा डोज देते हैं फिर धीरे धीरे कम कर देते हैं। तो जो भी ट्रीटमेंट है या हम लोग इंसुलिन ट्रीटमेंट जनरली प्रेफर करते हैं तो उसके साथ मैच करना डिफिकल्ट होता है। तो मैं एक तो आप बोलिएगा डॉक्टर साहब ये कैसे, मैं आप फेसबुक में आप सबका इलाज कैसे कर दें? नहीं, मैं इलाज नहीं करना चाहता फेसबुक पे, खाली मैं अवेयरनेस बढ़ाना चाहता हूँ कि बी aware that your diabetes needs to be controlled with steroids. You may require insulin treatment and it's very important that insulin requirement goes up very high during the period. अगर आपकी HbA1c बैकग्राउंड सही है, 7 के अंदर है और आपको डायबिटीज या HbA1c 6 है प्री कोविड, तो हो सकता है डायबिटीज सेटल कर जाए और कोविड-19 के बाद न्यू डायबिटीज तो होती है, लेकिन अगर स्टेरॉइड इंड्यूस्ड डायबिटीज है तो जनरली सेटल कर जानी चाहिए। अगर आपकी बैकग्राउंड HbA1c कितनी मैटर करती है, अगर आपके HbA1c ज्यादा है 3 मंथ्स के कंट्रोल, तो हो सकता है लॉन्ग टर्म आपकी ट्रीटमेंट इफेक्टेड हो जाए कोविड-19 के बाद। फिर से मैं रिपीट करता हूं कि कोविड-19 itself can precipitate new diabetes. COVID-19, any infections, prolonged rest can worsen the diabetes because you are at home quarantine, people are not walking because of the lockdown. And once you happen to have take steroids by doctors, so that's very essential part of the treatment. I'm not saying not to take it, because that's very important. Steroids are one of the most life-saving drugs, not even COVID-19, pre-OS as well. It is a bad name for some reason, but if steroids used properly, It's one of the best medications, so sasta, so cheap. But unfortunately, it has two main side effects. We should be aware. One of them is high diabetes and can weaken your bones on the long term. But in far as short period is concerned, very important that we give you insulin treatment if the sugar goes up high. If the sugar is going around 200, 250, we can accept it. If the sugar is going up high, we can give you what we call as the 4 injection shots a day, something with each meal, a rapid acting insulin or a short acting insulin, with breakfast, lunch, and dinner, and one long acting insulin with some oral medications, which I don't want to discuss and prescribe on the Facebook. But mind it, once we give a rapid acting insulin with each meal, the number of injection insulin required, particularly with the lunch ones, is very high. I can tell you that this was my experience even before COVID, and it can be very high. So you have to give large doses of insulin before lunch to counter the effect of steroids. So it's very important that an experienced endocrinologist or physicians who has an experience of handling that insulin, and also that rooftop blood sugars of 300 and 400 and 500 can go up, where the family get very scared. So it's very important to understand, yes, keep monitoring it. But most people who steroids induced diabetes, who have a background diabetes, would require insulin while in the hospital stay or post discharge. Post COVID-19, large number of patients with COVID-19, their sugar is up because they're immobile, they're still in the partly quarantine, and they're taking steroids. So you would require, some people or most people would require some insulin, and they may require large doses to counter the rise which tends to happen after 11 o'clock in the afternoon, in morning time, to late afternoon or late evening, and blood sugar may settle down. Depends upon the doses, what time you're taking, but most time you see blood sugars post lunch very high. It may not be able to handle by metformin or other medications, certain sulfonylurea class of medications, which we can use it. But the problem is, after metformin and other medications, the blood sugar can affect you all throughout, and we might be able to bring your post meal down a bit, but we may also cause hypoglycemia. So a doctor and endocrinologist need to be smart enough to understand the tricky situations where the blood sugar tends to go up temporarily during 7 to 8 to 12 hours. B, it's like taking the chair off while you're trying to sit. So when the steroids are coming down to, for example, you're on Medrol 32 mg twice a day, coming down to 16 mg twice a day, your blood sugar can suddenly fall. When the blood sugar can suddenly fall, you need to cut down the dose of insulin. That's also important. So it's very important to play with that. The idea is not to educate you, not to start insulin at home. It's very important that be in touch with endocrinologist who has that experience and expertise and confidence and guts to handle that blood sugar rise temporarily. And it's very important that we use traditional, what we call as a basal bolus insulin, which is with each meal we give you insulin. The advantage with the insulin that you can dial a little bit more. The advantage with the glucometer, you can test it. So I always say that the testing of glucometer is not a panic meter. To assess what's the need of your insulin requirement. So a couple of things, steroids temporarily going up high, your steroids can go up at the higher dose, the doctor can come it down, so you need to also match that. The insulin requirement can go up very high, COVID-19 can precipitate diabetes worse, so it needs to be handled on the long term. At the same time, a short-term transient, temporary high blood sugar should not harm your body. We would love whole countries' diabetes to be controlled at all the time, but sometimes technically not possible. So if you're not able to control it, don't worry. You can push the steroids, follow the respiratory physician's advice, and if the sugar is very high, again, consult us. But if it is high for some time, you should not worry too much about it, because ultimately the main goal is to avoid the COVID pneumonia, the lung damage due to COVID, and that needs to be handled by steroids. It's important to stay on treatment. The doctor sometimes can cut down the dose and an effective dose so that it can still have reduced the inflammation due to diabetes or COVID induced. So I know I've been talking more about COVID-19. Unfortunately, large number of patients I see today, half the people today I've seen have steroid-induced diabetes. And I know the family is frustrated. At the same time, we doctors are also frustrated about the pandemic, the contactless, on the teleconsultations, trying to explain people on the video consultation to explain about the insulin. The family is not aware how to inject insulin. Patients are somewhere home. the son or daughter outside the room, they can't go in the room. That's some of the technical challenges that what we face. Besides what the family is also facing, we are also facing the similar challenges within our healthcare system, trying to struggle to cope with this COVID pandemic, which Max Healthcare is right in the center of this. Unfortunately, large number of people are admitted in the hospital, and the hospital is trying its best to cope with our, relentless effort of the doctors, management, nurses, general duty assistant, security guard, consistent with the face mask and on the covering and the protection what we require, with the limited availability of staff space, with the restrictions which is almost going for almost 8 months time. You should also understand and appreciate of the frontline hospital in the front line, right at the front end of the country's pandemic, which includes Mumbai and Delhi. So, and Delhi being South Delhi, we are catering large number of people. The hospital is trying to cope with this. At the same time, you should appreciate what we are doing, and we also understand the frustration of patients that what they are suffering from. And there are certain challenges that what you faced, we also face. I just met other day a family, a son who's trying to handle an ICU bed in the hospital, in home setting. And I said, look, it's even for a doctor, it's difficult to handle the ICU in the home situation, because you're managing the swallowing, you're managing the bed care, you're managing the diabetes, you're managing the lack of nutrition, you're managing the weight loss in COVID-19. So a large number of patients who are not very young have gone into the chronic care. The requirement has gone up, insulin requirement, they have muscle wasting, they require large number of treatment. And the family, and I really appreciate those family, particularly those family, the son and daughters and the family and the neighbors who are looking after the COVID-19 patients. We also see a lot of negligence happening. We also keep talking about doctors' negligence. We also see a lot of family negligence as well towards the COVID-19. They are sometimes left alone, not treated well. And I'm honestly very surprised and shocked with certain family who are not treated well, really because they had COVID-19. So it's very important to take protections, look after your parents who have recovering from COVID-19. My talk is not to treat how to COVID-19, that our physicians and respiratory physicians are wonderfully doing across the country, including Max Healthcare. My talk is more about diabetes care, nutrition care. So it's very important. Now the question about the nutrition, what you should feed. I keep saying the best nutrition is what you eat for a normal food. If you're a non-vegetarian, then normally egg and chicken can be given normal food where increase of protein content, the dal and the doodh and the milk and the dahi. But if you're not able to take, you can take help with the protein supplements. But most protein supplements also have a little bit of carbohydrate that you have to be aware. They are processed carbohydrate and they can push the sugar up. But yes, if you're able to take the protein content from the natural means, from natural khana, then you're able to eat and feed them the normal khana pina, normal roti sabji dal with the paneer, or a non-vegetarian, or a fish, or an egg, or a milk, or a dahi. But if they're not able to take post COVID-19, then you can give certain protein powders, branded protein powders, or any powders which is there in the nearest pharmacy shop. You can take those and supplement with the meals so that they get back the nutrition, they can lose back the muscle wasting that they have. So what's important? Yes, post COVID-19, the recovery requires steroids, especially the lung disease. You also important that you also the cholesterol lowering medications, control your blood pressure, control your diabetes. Steroid-induced diabetes is a big problem. You need to handle it, mostly people with insulin. It's a tricky job. You need to understand, and the doctors need to understand that these are tricky jobs. The blood sugar tends to go up high. Your insulin requirement can go up very high. We need to gradually increase the insulin dose. At the same time, cut down the insulin dose when the steroids comes off. Nutrition needs to be well balanced. Little bit of mobility, some bit of physio, exercise, whatever the family can, whatever the patient can do it, please carry on. This is going on for some times. Hopefully, we still have Christmas coming, New Year's coming. We still have tough time during Christmas and New Year. I remember we still had a little fear of the last Holi. I still remember that. And unfortunately, we may not have a good Holi. Let's hope, let's celebrate. Eid will follow. I think by summer, once we finish the Eid celebration, hopefully we'll be able to sort this country out. And I'm sure our government will be able to afford to give vaccination to a large community, which is a huge challenge itself. So relying on vaccine on a daily newspaper, it sounds very exciting. I'm very excited. I'm very hopeful, but it will take some time. before the vaccination comes. And this COVID-19 is going to chase for us until the mask and the hand washing, which is required for a daily basis. So protect yourself. If you are in this middle of the pandemic, be very, very careful. The large number of doctors have also been got affected. Large number of healthcare people have also got affected. So, and it's very important for you to take precautions. Don't do stupid things and be very careful about it. So that's all from my side on a long lectures on COVID-19 and diabetes. Be aware, be careful, but at the same time, be prepared for rise in diabetes, rise in sugar. Get yourself screened, treated. If by chance, if you get diabetes well controlled and COVID-19, you're better off than those with diabetes with a poor control. So until you know that you have diabetes, you would not know how to treat yourself. So please contact your nearest doctor that you can get hold of diabetes treated properly, because if you don't have COVID-19 today, it can develop tomorrow. If you already had COVID-19, already on steroids, that also needs to be treated. Even if you're post-COVID-19, you have recovered from the illness, the diabetes remains important. Now, this lecture a year ago would have not meant any sense. I keep saying that diabetes is a killer disease, is a silent disease. It makes people 3 times much more at risk of heart attack. A lot of people, family, friends, and sometimes health community used to make fun of us that, look, what the hell you have been talking about for the last many years' time? That's not true. My uncle has diabetes, that remained fine. But now the COVID-19 are exposed that how bad the diabetes is, blood pressure, cholesterol, coronary artery disease, obesity. If you ask me, one of the biggest risk factors is obesity, diabetes, blood pressure, cholesterol, and itself is a risk factor for heart attack, stroke, and early death. That's my Facebook talk for hundreds and millions of times. If you happen to have COVID-19, that worsens things up. If you have COVID-19, be careful, get yourself treated. It's a scary disease, but make sure you get it controlled, get yourself treated. Most people, even if you're old, if you have diabetes, you're well controlled, even if you get steroids, your treatment, and you will survive this COVID pandemic, even if you suffer from it. The best thing is to protect your diabetes, protect from COVID-19, take all social precautions. What government of India is saying, what ICM are saying, they're right. Don't take it lightly, follow the protocols. And most people who have taken protections, even if they face the COVID-19 patients, they were able to protect myself. My personal experience so far, today till 23rd of November, I've not been affected. I have been taking precautions, and I do hand washing. I carry the hand wash all the time with me continuously, so that I can protect myself. So it's very important that you treat yourself, you protect yourself so you don't get COVID-19. So that's all from my side. Back to any questions, if any. Raman Sharma, are diabetic patients more close to get COVID-19? I don't think so. There are. No, what the question is that once you have diabetes, COVID-19, you may do bad. But are the diabetes patients more prone to COVID-19? The data are not so far suggested so far. So in one thing, that if you have COVID-19 in 2 rooms, one with diabetes, one with non-diabetes, that if, say, for example, 50 with diabetes and 50 with diabetes, does that 50 with the COVID-19 diabetes patients would have more COVID-19? We don't have that data. With that 50 patients sitting in that COVID-19 room, and they get diabetes, they get COVID-19, they will do worse. But would they have more risk of having COVID-19? We don't know that data. Because local protections, immune protection, skin protection might get affected, but so far we are not aware of. But yes, if you have diabetes, you should take more precautions, because if you happen to get COVID-19, you will do bad. Gunjan Verma, my son is 15 years old and has type 1 diabetes. I'm so scared for him. What precautions should I take to keep him safe and precaution? Gunjan, so far it is true that type 1 diabetes are also much more vulnerable. And your son is obviously more vulnerable for COVID-19 complications. But the young people, and I'm sure he has a short history of type 1 diabetes, should not really affect him so much. And those people with a type 1 in the late 30s and 40s tends to have more effect on their COVID-19 rather than a young 15-year-old kid. The data is quite good for a young type 1, even 15 years old. But type 1, you are right, Gunjan, have much worse than non-type 1. But when it comes to age 15, unlikely. So make sure what precaution you can take is all social precaution that a 15 years old kid may not be taking, but they should be taking. Is all social protections, including hand washing. And controlling diabetes, make sure you have a time. So make sure your HbA1c should be 7, your sugar should be controlled, and taking all precautions to control diabetes, control hyperglycemia, control nutrition, and social distancing. But even if worst case seen, if it happens to get exposed, unlikely that he would do bad because he's a young man of 15 years old. I hope you have answered that, Gunjan. COVID is more dangerous for type 1 diabetes, for type 2 diabetes. I think it's more dangerous for type 1 than type 2. Depends upon how much type 1 diabetes you are. And that type 2 associated with the risk factors. If you have type 2 diabetes and also hypertension, coronary disease, obesity, and long-standing diabetes and poorly controlled diabetes, you're much worse. So type 1, if you have more than 10 to 15 years of type 1, then yes. But otherwise, if your diabetes is well controlled, you're less affected. But type 2 as much. Data are different coming from UK. The type 1, type 2 versus comparison has been done. But for all practical purpose, for all general population, you must understand that diabetes per se is a problem and you should control yourself. You have time. As I was telling, that diabetes is a long-term impact. If you control it today, it has impact 5 years, 10 years down the line. But in pandemic case, it might have an immediate impact if you control your diabetes. What is more? So I've answered, Rohit. Next question, please. Sir, my father is COVID positive. His doctors have asked to take COVID medicine only till when he recovered. He is not taking his diabetes medication. What is the avoid of any complications? So, if the question is, Anita, that your diabetes should be controlled, your medication should be continued. I don't know what your doctors advise your father, but your sugar should be checking regularly. Your sugar should be fasting between 90 to 130. After meal, less than 200. I'm being a little broad, even if that level of control is acceptable for the time being. If it's not, talk to your doctor, talk to your GP, go to the nearest physician, come hold of Max Healthcare. You can take appointment with our physicians, endocrinologists, and get in touch with any of us and get things controlled. You can do home monitoring, but I think your diabetes medication should be continued. Some medications are avoided by doctors for a particular reason. So speak to your doctor who has been treating your father's diabetes. Next, please. What is suggestion on keeping hypoglycemia in control? Hypoglycemia, Priya, if it's background to the COVID-19, hypoglycemia, 30 minutes walk, मैं बोलता हूँ धरती पे चले, धरती का खाएं. I've told this so many times on my Facebook. 30 minutes walk, good diet, processed food को avoid करें, मैदा चीनी को avoid करें, weight को control रखें. 30 minutes walk every day, 5 fruits fiber a day, control your weight, get yourself screened, get yourself treated. If you require much more than that in exercise, your HbA1c should be 6.5. If your HbA1c is not 6.5, you must get your own medication. Speak to your doctor. If you're on COVID-19, more important for us to control diabetes, blood pressure, cholesterol. Diabetes is not hyperglycemia. It is cholesterol and heart disease as well. So very important to control your hypertension, cholesterol, walk, exercise, non-smoking. So next question, please. Can coronavirus cause diabetes? Yes. Khan Saab, Mrs. Khan, Hina Khan, Miss Hina Khan, yes, it can cause diabetes. COVID has been, we have seen in our hospital, COVID can precipitate new onset diabetes. As I was discussing, Hina, that large number of patients never screened. So they come to the hospital, they got screened. Almost like 20% people walking in the hospital can have diabetes. The question is, large number of walking in, they never got tested, and they get tested when they have COVID-19. One. B, COVID-19 can itself precipitate diabetes. That we have seen from our data. We have seen our data in Max Healthcare that we've seen. Once you get COVID-19, you're bed bound, your diabetes goes up. Once you're on steroids, it goes up further. So that's the problem with COVID-19. Poor mobility, poor nutrition. Also, a lockdown period of 9 months have worsened the diabetes cases as well. Can coronavirus cause diabetes? That's my answer to Salim Ali Saab. Is there any chance of type 2 diabetes to survive the COVID virus? And if they survive, will there be chances to get chronic? Every people with type 2 diabetes and COVID is not dying. It's not that scary. Our hospital data suggests that if you're a fairly young time, if your diabetes is well controlled, if you're well treated on time, reach the hospital, get the bed as well, and be treated by our wonderful physicians and respiratory physicians and ICU consultant, in any hospital in the country. They have got a good experience, and they are wondering the protocol which came from the steroids-induced diabetes. They are treated well, but their diabetes should be controlled. Not all diabetes patients do bad. Certain diabetes patients do bad, but not all. So it's not that scary. So yes, diabetes should be controlled. If you have a standard protocol treatment, which ICM, Government of India, is suggesting, or what Max Healthcare is suggesting, and follow that protocol, you should be able to say certain people are still would die, unfortunately, mainly age, excess body weight, poor diabetes control, and they do bad. Their lung condition can be bad. They can have heart attack and stroke. That needs to be treated. That's why, yes, Salim Ali Saab, it's not that horrible situation. Still, we have time to control diabetes, get yourself treated, get in the hospital, go to your nearest physician, go to your nearest doctor, and hopefully that will control. So the answer is, every diabetes COVID patient is not going to die. The answer is no. Not all would die. Some people may die. The risk is higher. Next, please. Akash Bharadwaj, is hyperglycemia and diabetes related, and with the amount of blood sugars? So hyperglycemia, temporarily we use the word hyperglycemia. Hyper means high, glucose is high. So technically hyperglycemia is diabetes, but certain hospital situations, for example, if you have no diabetes and you're given steroid, and steroid having hyperglycemia, we don't call you diabetes. The diabetes usually diagnosed once you're in the chronic stable phase of condition. So that's why it should be repeated 6 weeks apart. So ideally speaking, hyperglycemia and diabetes is similar, but certain infections, for example, even get a dengue fever, my sugars goes to 280 randomly, my doctors will not call me diabetes. They will ask me to repeat after 6-8 weeks time and see what the blood sugar is. So hyperglycemia usually, traditionally, we use for a transient, any infection like COVID-19, or which can temporarily rise, and we can understand from HbA1c that this patient may not have diabetes, and this could be transient. Once diabetes, we usually once established diabetes, that's what we established the diabetes. And hyperglycemia, as I think Swati was talking about hyperglycemia and steroids, which is more a transient phenomenon. Next, please. After meal using glucose meter, how many hours should I get to it more than 180? So Anita Roy, if you have no diabetes, your fasting should be less than 100, and after meal should be less than 150. If you have diabetes, it should be between 90 to 120, and after meal should be 130 to 150 in most young people. If you're a little older, it is acceptable to have less than 200. If you have other comorbid conditions, if you have kidney disease, other disease, you can be higher. What important is fasting between 90 to 180. If you're pregnant, much lower, but usually acceptable range is fasting around 100, after meal 150, up to 180 if you have diabetes, acceptable. If you do not have diabetes, you will forget in pre-diabetes. So in a patient with diabetes, we don't get it as normal because of the risk of hyperglycemia, but better to control as much as in the non-diabetic range. And what's your HbA1c is important. What other risk factors important, and do you get any hyperglycemia? So it's very important to control. Broadly speaking, less than 180 is acceptable post-meal, 2 hours after the first bite. Next, please. Arun Bharadwaj, I have high glucose in my urine, but not normal glucose level, no diagnosis of diabetes, but I frequently urinate often, feel thirsty. Now, diabetes is diagnosed by glucose testing, the venous glucose, the lab guys who comes to the glucose and do it. So very important to understand that. And it should be done in a fasting 10 hours, and 2 hours after glucose should be tested with an HbA1c. If you have only urine glucose, it could be simple hyperglycemia, which is a very rare condition, but can happen, and can happen because certain drugs taken. But if you don't have diabetes, if HbA1c is 6.5, you will not have diabetes. Now, I frequently often urinate and thirsty. If your sugar levels are fine, then unlikely that's the reason for your frequency of urination. Frequency of urination can be because of the prostate issues, urine infections, any fungal infections, or sometimes calcium issues, and certain drugs can cause frequency of urination. But usually, if your sugar levels are normal, as we discussed just before this, your question, the levels are normal, HbA1c fine, your sugar levels should be really above 250 to cause frequency of urination. If your sugar levels are below 250, even if you have diabetes, even if you have high sugars, cause frequency of urination. Frequency of urination happens after 250, generally speaking. So you have UTI, other things, you should get urine tested done. You should speak to your prostate urologist or get your prostate ultrasound done and urine routine done to make sure there's nothing. You can also get your calcium check done because that can also cause high calcium as well. You can get routine tests, including routine culture, prostate ultrasound. I know I'm not advising being doctor on the Facebook, but it's worth doing that if you're not in this pandemic world and you can speak to a physician who can advise you on that. Next question, please. With diabetes type 2, my liver releases stored glucose when it's diabetic. My blood sugar is low, assuming it's not any insulin. So with diabetes type 2, will my liver release impaired if stored glucose when it detects my blood sugar is low, assuming it's not taking any insulin? So Nancy Kochik, so I think you have asked a little complex question, but I'll try to simplify. So when we eat food, the glucose is absorbed, it goes into the liver and stored in the liver, and it continuously releases it. So the job of liver and the kidney and the muscle stored is continuously release the glucose. Even if I'm non-diabetes, my sugar levels goes up to 100 level if I'm non-diabetes. If I have diabetes, my blood sugar fasting will go up. So it's not related to last night meal. Your fasting glucose can relate it to your weight, hepatic glucose, your baseline insulin secretion. If your fasting sugar is fine, some people can drop their blood sugar levels. I don't know, you're talking about post-meal drop, that's called postprandial functional hyperglycemia. That's a completely different thing. But your sugar level should be around 80 to 90. If you're a young, thin lady, you can have up to 70 to 90 to 100. That's a normal level. If you're dropping blood sugars below and consistently dropping the sugars and your venous blood glucose in the lab, not at your home, is falling below 70, then you consult an endocrinologist regarding that. Without insulin, without taking any medication, interference of any medication. Yes, if your sugar is dropping, whatever it is, below 70, detected in the venous lab testing, you must consult endocrinologist, not even physician, endocrinologist. It can happen that postprandial drop. Some people can have fasting 110 and can drop post-meal up to 50, 70 and 80. That's almost like a normal condition, but also needs to be investigated and confirmed by a doctor. So that was a question. The previous answer, during hypoglycemia, can we feed that person normal sugar? Yes. Preferred glucose followed by sugar. Checked 15 grams of glucose followed by some sugary drink. Check it again in 15 minutes time. The patient is well, fine. Otherwise, keep another sugar. If the patient is unconscious, please come to the hospital. Hypoglycemia, anything below 70, anything below 50 is dangerous. Yes, sugar, glucose preferred. And normal khana, you should give a normal carbohydrate to avoid anything happening for a long term, so sugar can drop after further that. So be careful. Sugar, glucose, 15 minutes later, patient unconscious, get in the hospital. Patient not able to swallow, get in the hospital because it requires intravenous glucose or glucagon injections. What is the range of HbA1c for controlled diabetes? Less than 6.5 generally. Can be reverse diabetes, a stop medication if you have a normal range. Reversing diabetes, if an HbA1c without medication below 5.8, we call it reverse diabetes. But it's a very technical definition. But if you're without medication, HbA1c maintaining around below 6, then you are in the pre-diabetes range. It should be below 5.8 without medication. Reversal of diabetes is in any of my videos. Please visit in my videos. You'll find reversal of diabetes as well. We have taken a huge lecture with my colleagues Manju and Bombi as well in the past. So please look at the reversal of diabetes video. Next, please. So I think I explained HbA1c below 6.5 is pre-diabetes and 5.8. Anything below 5.8 we call it non-diabetes. That too without medication for a year. Is diabetes in my during my daytime urination control, nighttime is increases. So it could be, the thirsty, because check the sugar. Some people have high sugars at the late night, evening time, and that can be the reason for high diabetes. So urine frequency can be because of prostate problem, urine infections, certain medications, high diabetes, urine tract infections. So just check those things. Next, please. And God bless you as well, Naveenji. Thank you very much. And God bless His human mankind. We are going through a tough time. I never thought